So welcome today to the research conference. And again, in terms of logistics, so make sure you submit your questions using the Q&A feature while the lecture is underway. But on the other hand, if you actually like to pose the question, for example, in person, do use the chat function at the end of the presentation, and we will be able to unmute you and you can ask the questions live. And but on the other hand, if you have any technical difficulties, please use the chat feature to let Kelsey or Allison know, and they will be able to connect you in. So we're absolutely delighted today to invite Dr. Kelly Cobey back to our research rounds. And Dr. Kelly Cobey currently is the investigator at the Ottawa Hospital Research Institute, working on journalology, knowledge translation, really, very innovative areas of research. But she's already working with us at the Heart Institute as our publication officer, and more recently helped us to develop our institute's data management strategy at a high level. And these are really very important developments. And as a publication officer, she provides a consultation to researchers on the topics such as effective scientific writing, peer review, and the publication ethics. And her research focuses on the ways in which health research can actually be improved through some of the strategies which she will present today. And her work addresses questions like, what are the consequences of reporting bias and poor quality reporting? And how can we actually address the challenges of predatory journals in the current scholarly landscape? And how can researchers most effectively and safely share their study findings? And what type of a support do researchers need in order to conduct their work transparently and openly and effectively? By addressing these key questions, she aims to really drive improvements in the quality of publications and knowledge dissemination. And as folks may already know, that she's a consultant for several major external organizations, including Public Health Agency of Canada, Children's Hospital Eastern Ontario, University of Ottawa Heart Institute ourselves, including, and also Canadian Agency of Drug Technologies in Canada. And she's quite often called on as the expert in terms of science policy topics. And so she, in fact, has provided major institutional strategy input, for example, on data management for Montreal Neurological Institute, McGill University. And she really actually was the consultant behind the tri-agency's data management policy today that is being implemented. And in fact, we figure that it's really good to actually get advice from the original expert that actually put all this together. Kelly currently is on the advisory board of DORA, that's Declaration of Research Assessment, which is really actually the new way in which we can assess research productivity, and is involved as a pilot institution member with COPE, which is Committee on Publication Ethics. And she's really recently acknowledged by University of Ottawa as a recipient of Open Scholarship Award. And she obtained her PhD in psychology from University of Groningen in the Netherlands, and has an MSc in advanced biology from University of Liverpool. And she also has a psychology degree from McMaster University. And she has cross appointment in the School of Epidemiology here. And prior to current post, she worked as a lecturer at the University of Stirling in Scotland, and also worked in France under the auspices of Friesen Research Fellowship. So today we are absolutely delighted that Kelly is able to share with us some of her insights on how meta-science can help research thrive. This is really a fantastic insight for us to go forward with. Thank you so much, Kelly, and apologies for the delay.
Thank you so much, Dr. Liu. Really appreciate it. And thank you to all for attending today, for giving up your time to learn about the program. So I thought today, in terms of an outline for our talk, I'm going to begin by giving you a little bit of introduction about me. Peter's done a really fantastic job of doing that already, but I'm going to provide a little bit more context about sort of my academic background and how I have the expertise in meta-science that I've developed. Then I'm going to move on and talk about my current role at the Ottawa Hospital Research Institute and the meta-science research program that I drive there, before concluding with talking about how I sort of see what I do in terms of my research program fitting with the Heart Institute and the strategic goals that they have set for themselves for the future. Okay, so In terms of academic background, as Dr. Liu has mentioned, I am a social psychologist by training. So I did my PhD in the Netherlands. And these are some examples of some of the papers I published. It was a very productive PhD. I had 11 papers before I finished. You can see they're in a mixture of social science and medical journals. And broadly, what I was looking at during my PhD was how changes across the woman's menstrual cycle, as well as how initiation of hormonal contraception influences behavior and psychology. So although I was a social psychologist and in training in that discipline, I had a lot of interaction with the University Medical Centrum, as well as with Clinical Trials Center. Following my PhD, I was really fortunate. I got a position right away as a lecturer or assistant professor at the University of Stirling in Scotland. And then as Dr. Liu mentioned, I got some fellowship funding from the Fison Fellowship out of France. So this was great. And in this role, I continued to push forward my work in the area of behavioral endocrinology. Following this, in 2015 was sort of a big move. So I moved back to Canada, where I'm originally from, and I took on a position in the Ottawa Hospital Research Institute's Method Center, specifically working in the Center for Journalology. So journalology, if you're not familiar with it, it's the study of publication science. It's a sort of umbrella discipline of meta-science, which is research on research. So I'm currently still working in that role. I've been there about 6 years. I'm an investigator there now. And I also have this adjunct appointment within the School of Epi and Public Health, as Peter mentioned. So at this point, you might be wondering, okay, what happened here? So, I'm trained as a social psychologist. I had this research program in behavioral endocrinology. I was starting to build a career in that direction. I know I've just told you that, 6 years ago, I joined the Center for Journalology. Well, I want to provide a little bit of context to how I became a meta-scientist and decided to sort of focus my academic career in that area. Because I think that context is important. And I will say as well, few people are actually trained in meta-science, and most encounter a sort of shift similar to the one I'm about to describe. So the first thing that I'll mention was that during my PhD in the Netherlands, there was the downfall of Dietrich Staple. So Dietrich Staple, if you're not familiar with him, he's a very prominent Dutch social psychologist. They called him the Wunderkind or Wonder Child. He rose the academic ranks extremely quickly. He was full professor at a very young age. And I never met Dietrich personally, but he spent much of his career at the institution that I got my PhD from. And what ended up happening was 2 whistleblowers, postdocs in his lab, basically identified that he'd fabricated and falsified some data. Subsequent to this, a larger national investigation on him and his research was conducted. And that investigation happened to be led by my PhD advisor, who was at the time the head of the Dutch Royal Society's social sciences branch. And this was really interesting. I got sort of a lot of information about this investigation. And, by the end of it, 14 of the 21 thesis projects that Dietrich supervised, so his PhD students, also had to be sort of rescinded and retracted. So there was major issues with both fabrication and falsification. This is a clear example of a bad actor in terms of the behaviors conducted. But having seen this downfall and seen how it implicated upon my colleagues and learned about the investigation, this experience started making me ask questions about the academic system itself. And, were we doing enough to enhance transparency? And was there sort of safeguards in place to prevent situations like this from occurring? So that was the first thing that happened. The second thing that happened was this landmark paper. So this was published in 2015, but the work was over a few years prior to that, again, during my PhD. And it was entitled Estimating the Reproducibility of Psychological Science. It was published in Science. And there were a number of findings, but 2 really key findings that I took from this were that these researchers, they took 100 psychology experiments from very prestigious journals in our field, and they reproduced them. And what they found was that just 36% of the replications had significant results compared to 97% of the original studies. And when they looked at effect sizes, it was 47% of the original effect sizes were in the 95% confidence interval of the replication effect. So really, no matter what way you look at it, whether it's effect sizes or p-values, the vast majority of the discipline that I was training in was not reproducible. So again, learning of this and thinking about how issues of publication bias might contribute to this really started me asking a lot of questions about the scientific system, about issues of reproducibility and incentives and rewards in academia that exist, and whether they foster the appropriate research methods and supports that we want to as a research community. So I applied for a position working in the Center for Journalology. The center is directed by Dr. David Mower. And here on the screen, you can see the other PI members of our team. It's a really diverse group, both in terms of expertise as well as research interests. We have clinician investigators as part of our team. There's a health psychologist, information specialist, and a health systems researcher. It's a really great group. And in the first year that I spent as a member of the group, it was almost like a micro PhD. So I had about 1 year to just train and get up to date on policies in this space, and also to sort of siphon off knowledge from Dr. Mower. And in that year, I sort of developed educational outreach resources, and I think the basis for the expertise that I continued to develop over the past 6 years. So I want to give you a bit of a context of what I've been doing in the center. And broadly, you can say that I wear sort of 2 hats. The first is a hat pertaining to teaching and consulting, and the latter is pertaining to research. So what I'm going to do is I'm going to talk a little bit about some of the teaching and the consulting that I've done. Dr. Liu's given you a bit of flavor of some of that. And then I'll move on and talk about the program of research that I've been actively involved in and looking to continue to push forward. Okay, so when it comes to teaching and consulting, a big part of what I've done is educational sessions. So whether it's a round seminar or a residence research day, I give a lot of talks on topics related to publishing best practices. So looking at ways to help researchers publish in a way that's most impactful and most usable. And there's a variety of topics that I've lectured on. I also teach a master's course. I co-teach this with Dr. Mower at the University of Ottawa in publication science. And this is an open course across disciplines, originally started within the School of Epidemiology and Public Health. We're actually running it this semester, and it's been really interesting and enriching to sort of work with young trainees and get their perspectives on journalology and publication training. I spend a lot of time as well creating educational materials. So for example, you see here a screenshot from the Center for Journalology website. I do a lot of the maintenance of the resources there, so you can get a flavor for some of the resources that we've developed. I also have worked on policy development, so things like authorship guidelines, affiliation guidelines, data management guidelines, as well as ad hoc consulting. So at the OHRI, as well as the other institutions where I have consulting contracts, including the Heart Institute, people can literally email me sort of on demand to arrange a meeting or with questions about their specific research projects and how to overcome a publishing issue that they're having. So I have to say, I've really enjoyed the teaching and consulting that I've done. One thing that is definitely true is that there's a great appreciation from the community to get this support, be it in an educational session, a website, or one-on-one consulting. There's not a lot of training in this area of publication science. So researchers I have found to be very grateful to have that support from the institution. I wanted to also illustrate that while I've been active doing this teaching and consulting, I've also tried as much as possible to document that teaching and consulting, as well as evaluate some of the education that I've done. So here's an example of some of the publications that have actually stemmed not from my research, but from the teaching and consulting that I've done, including a piece in Nature about predatory journals and a piece in CMAJ more broadly about my role itself. So I think this reflects the fact that, you know, even as someone who studies this for now 6 years and has developed expertise in this area, it's really hard to stay up to date. There's a lot of changes happening in the publishing landscape. So for the average institution or the average researcher, I can imagine it's even more demanding. So knowing what an institution can do and what we've done and how others can learn seems to be of interest to the community. Further to the outreach and consulting that I've done, I now have a number of leadership roles within the community based on the expertise that I've developed. So these are both national and international. So I'm a member now of DORA's steering committee, which is an international organization looking at how we can foster better incentives and rewards for academics to support higher quality research. Also a federal science policy committee on research data. I'm a member of Equator Canada, which fosters and supports knowledge about reporting guideline checklists. I'm also an ambassador for the Center for Open Science, as well as COPE, the Committee on Publication Ethics. I'm an institutional partner there, trying to bring resources about publication ethics away from journals where most researchers don't read them and actually into academic institutions. The work that we've done in the center, and I think the work that I've led and contributed to, is highly topical. I think we've really engaged and created a lot of public discourse around research and publishing best practices. So here you can see some examples of some media coverage we've had in recent years about the center. So just to sort of illustrate that, I think that, if you've not heard of journalology or publication science, you're not alone. There's not a lot of experts out there, but the fact that we've created this sort of group of core individuals working in this space has attracted a lot of attention. Okay, so I hope that gives you a little bit of a flavor of my academic background and some of the teaching and consulting that I've done. I'm going to spend the next several minutes talking about my research program. And again, this is, in my current role, I spend about 50% of my time in research. And just like with teaching and consulting, in terms of my research program, I'm interested in improving the transparency and reporting quality of research. So today, because we're time limited, what I thought I'd do is break those sort of goals down into two core themes, namely the reporting quality of research and enhancing the transparency of research. And what I would do is I would give an illustrative example of a study from each of these themes so that you get a sense of the type of research that I do, as well as the type of methods that I use to approach my research. So I'm going to start with reporting quality of research. And in that respect, I'm going to describe a program of research pertaining to predatory journals. So when many people think about predatory journals, I think they think of emails like this. So these sort of cheeky emails that we get. This particular one that I've chosen to share is actually sent from Elton John, which is very nice that he would be corresponding. And, they're, greeting the author. They're promising fast-track publication in cardiology cases and systematic reviews, no publication fee. This is how most people, I think, are familiar with predatory journals. And indeed, these are dubious journals that are trying to seek submissions from authors so that authors pay a fee typically to the journal so they make money. So they're interested in profit. They're not necessarily interested in maintaining rigorous standards of peer review or publication best practices. But we know these emails aren't the only way that researchers find out about predatory journals. Many, for instance, from research that we've done, actually Google search for a journal after they've been rejected a few times, and they find a website from a predatory journal in that way. So I'm going to talk about a program that our center has done looking at predatory journals that I've had a leadership role in. And the interest in this area, I think, began around 2017. And in that year, what we did is a very large epidemiological study examining almost 2,000 articles published in presumed predatory journals. So these articles stemmed from about 200 journals that were thought to be predatory. And what we did is we extracted characteristics from the articles. And a couple of key findings that I wanted to illustrate was that, at the time we did this research, I think, predatory journals, people thought they were kind of funny. These emails that were, sent to them were a bit of a nuisance, but that was sort of it. Well, what we found was that, in fact, researchers around the globe publish in these journals. And over half our sample of articles came from high-income countries. So this was definitely not something that, institutions like our own or institutions in high-income countries could continue laughing at. In our particular sample, Harvard University, which I would argue many would view as very prestigious and is certainly in a high-income nation, it was in the top 10 most prevalent institutions in our sample. And when we looked at these nearly 2,000 articles, and we saw whether they had funding or reported funding, when we looked at who the funders were, the NIH, the American federal funder, was the #1 funder of health research in these predatory journals. So obviously that's quite problematic. And it would suggest that, federal tax dollars are going to support work in these journals. And this is problematic. It's sort of a double-edged sword here. So it means that potentially good work is going to be published in predatory journals. And that's concerning because these journals typically are not indexed or archived. So that would mean that, if we're doing a systematic review, we're not necessarily going to find them. However, on the other hand, it also means that people who may be conducting low quality work that might not meet the merits to pass through peer review may find a means to share their work and get credit for it on their CV. And while, many researchers may not find that work, these journals, while not indexed and archived traditionally in scientific databases, they are available on places like Google. So they can find their way, these articles, into the hands of patients. So based on that initial study, this led our group to conduct a program of research around predatory journals. So I'm going to talk a little bit about that program now. What we did is, after our initial study, we determined that we needed to come up with a consensus definition of what a predatory journal was, because like with any sort of epidemiological phenomenon, in order to track something over time or measure the effect of an intervention to reduce something, you have to have a definition of sort of core characteristics. So we began by conducting a knowledge synthesis project. So we did a scoping review around the evidence and characteristics of what predatory journals were. We found that almost everything out there took the form of an opinion or an article. There wasn't a great deal of empirical research. So we were able to sort of tease the two apart. And we came up with a list of potential characteristics, which through a iterative survey technique called the Delphi method, we then presented to a group of international stakeholders from around the globe representing different sort of interests. And that group came together and had a consensus meeting. And in that consensus meeting, they agreed to a definition of what a predatory journal was and the specific characteristics. And they also agreed of a plan of action in terms of what the community needed to do to actually address predatory journals. So this was a multi-year program, and we were fortunate we got funding both from the President's Fund at CIHR as well as the Swiss National Science Foundation. So in terms of our consensus, this piece was also published in Nature, as was the original epidemiological piece. So there's a lot of interest in, I think, mainstream cross-disciplinary journals for this type of meta-science. In terms of this definition, the outcome of this meeting was, of course, the definition. But in terms of the plan of action, two things that the group said that the community needed were one, a one-stop shop of resources. So this was the idea that we needed a website that contained all the resources for all the stakeholders to understand what predatory journals were and to educate and support their population, be it through training or through policy to avoid these journals. And then the second thing that they said that they needed and the community would benefit from was something that we termed a digital tool a journal authenticator tool to check journals. So the idea here was that if a user was able to press a button when they were viewing a journal to find information about the transparency practices or quality of that journal, that would help them get real-time information about whether they should submit to the journal, read the journal, or interact with the journal in any way. So following this consensus meeting and that publication in Nature, we sought out funding, and we obtained funding from Tehama, which is at the Ottawa Hospital, as well as Canada Health Infoway. And we set to work on exactly that. So we had our consensus, and we wanted now to create the one-stop shop of resources, as well as this journal authenticator tool. So the one-stop shop of resources, I'm happy to say, launched last month. The link is there. And it has a number of things, but some of the things that I'm most happy with is that there's a repository of policies about predatory journals. So for instance, if you were a funder and you wanted to create a policy about predatory journals, you could go to our website and you could find other policies that you could use for repurposing for your specific funding institution. The other thing is that it's really diverse supports for different stakeholders. So they're sort of purpose built here. And we have a section specifically for journalists, patients, and the public. This was completely co-designed with patient partners and contains non-technical summaries of the work that we've done, because we have seen that patients have had issues with interacting with predatory journals as well. In terms of the final sort of need established in the consensus meeting, in terms of making this journal authenticator tool, we're excited to work on doing this now. So we have initial funding to do so. And what we're doing is we're taking a user-centered design approach. And I think this is really important. So basically, rather than just making a tool that can, tell you real time whether something is indexed, for example, or whether something is a member of the directory of open access journals, or these sort of indicators of transparency, rather than just making a tool, we're actually obtaining the preferences and perceptions of different stakeholders. And then we're going to take those into effect when we build our tool and get feedback on a prototype from them. And the thought here is that if we build the tool in this way, it's more likely to resonate and meet the needs of the community. So we've been active in this space already with our funding from Canada Health Infoway. We recently established patient perceptions and preferences, and this preprint of our findings was published about 2 weeks ago. We're now working to establish preferences for other sort of stakeholder groups to continue building this tool. And in that respect, I wanted to highlight our newly hired postdoc, Dr. Jeremy Ng. So David Moore and I are supervising Jeremy, who recently was awarded a MyTax-funded postdoc that started in September. And that was through industrial partnership we obtained through EBSCO. And he's going to focus on establishing the preferences of journals and publishers for this journal authenticator tool. The final group that we're hoping to establish preferences for is research. I'm getting some negative interference from someone.
Yeah,
okay.
So if you're not a speaker, please make sure you mute your microphone. Thank you.
Oh, thank you so much. So the final group is researchers, clinicians, and institutions. And we're hoping to actually submit a renewal application. So this is work in collaboration with a colleague, Dr. Manoj Lalu, who's an anesthesiologist. And that application is due in October. So with that funding, if we secure it, we will have all the funds needed to move this project through to completion. So in terms of our predatory journals projects, I've given you a sense of sort of the program of research we've conducted to date. But before moving on, I wanted to really highlight the knowledge translation aspect of this work. So in general, a lot of the research that I do in sort of publication science and meta science, it involves sort of auditing how a particular practice is being performed within academia or within the research community. And rather than simply sort of doing that audit and then just saying, okay, things aren't going very well and sort of raising red flags, a big focus is actually, once we've established sort of shortcomings or areas where we can improve, actually developing interventions and tools that we can implement and then evaluating those to make sure we're making progress. So I think through the predatory work, you've seen that with the consensus definition and then the educational resources and the journal authenticator tool. So they're very action driven to address the problems that we've identified. And in terms of other knowledge translation to highlight, I think we've really increased public discourse on predatory journals. And the presentation of our work we've shared it with many key stakeholders. And there's actually been real policy impact, which is really interesting. So from a Canadian perspective, there's now a current draft tri-agency statement on predatory journals, which I suspect will be coming out soon. And there's already a policy that's existed for several years stemming from our original Nature paper on the epidemiological characteristics. And this policy is from the NIH, who you'll remember was the #1 funder in our sample. So they responded almost immediately to that work. And they've come up with this policy to help educate and circumvent publications they fund from going to predatory journals. Okay, so that's sort of an illustrative example of some of the work on reporting quality of research. I think reporting quality is so important because oftentimes, researchers, they get to the end phase of their study and they just want to write it up and publish it as quickly as possible and move on to the next thing. But if we're not publishing things in a way that are usable and most accessible, I think that's quite problematic. So that's where my interest lies in that respect. I'm going to move on now and talk about enhancing the transparency of research. Okay, so in terms of this theme, and I guess, again, this is just sort of an illustrative example of research in this space, but, I'm interested in considering ways we can make the research process more transparent for others to make sure that we're maintaining the integrity of research, but also making research more usable. And one area where this interest permeates is in terms of data management. So as an example of my work enhancing transparency on data management, I wanted to highlight Dr. Sanam Ibrahimzada, who again, I co-supervise with Dr. David Mower. And Sanam started her postdoc in September of last year. She's funded sort of in mixed sources. So right now she's funded by a grant that I obtained through Compute Ontario. And in that respect, she's helping to create training resources on data handling. So the reality is that most researchers and most research institutions don't have a really great handle on data management or data handling practices. So for instance, things like best practices aren't formally taught. And that means that there's not a lot of standardization, even within a lab, but certainly between labs or research groups within and between institutions. So I think this opens individual researchers as well as institutions up for potential concern. So some of what Sanam is working on is actually creating training so that it can support researchers in knowing what best practices are, and not just knowing what best practices are, but having very practical like handouts and resources that support them with actually being compliant with these best practices. Because I think that's where policy often falls short. You know, you can tell people what they need to be adherent to, but if you don't tell them how to be adherent, it's not very easy to implement that policy. So Sanam is helping with that. And we're also doing some work funded by the Neuro at McGill in Montreal. And basically, if you may have heard that the Neuro made a commitment a few years ago to become the first open science institution in Canada. And as part of that, they have a number of different plans. But one plan is to improve the ways that they currently manage data. So have a better handle on whether data is maintained robustly and managed in a way that's meeting best practices. So in that respect, we're currently doing a project which involves taking a cross-section of a year of publications from the Neuro. And what we're doing is we're looking at a variety of different practices relating to data handling and data management. And we're going to be able to report that back to the Neuro to say, you know, this is the proportion of papers that have a data management statement. This is the proportion of papers that share data. This is where people are sharing data, so that they have information about that. So I think that that's really important, especially Dr. Liu has mentioned these incoming mandates around data management. One thing that's important to realize is that I think there's a view in many of these policies to move towards data sharing, but that is to come later and where it's appropriate, I think. With regards to the policies right now, the focus is on data management, and we can't have data sharing ever where appropriate unless we have robust data management. So we don't want to be in a situation where we're sharing data that's not helpful. So if we're going to develop a culture that moves towards that, we need to focus on data management, I think, at this point. So in the respect of this sort of theme of research around transparency and around data management, I wanted to highlight a project that I recently had funded through the Wellcome Trust in the UK. And essentially what this would be to do is to develop an institutional dashboard to track various transparency practices of an institution. So I mentioned how Sanam is helping to lead a project with us where she's doing an audit of a cross-section of 1 year's worth of papers from the Neuro. The idea for this tool is that we would create an automated tool that could provide real-time information about various transparency practices to an institution. So for example, we might look, where is their mandates? One mandate is, for instance, pertaining to open access. Do institutions or stakeholders like funders have a good grip on what proportion of the work that they're producing adheres to funder mandates? And we think probably they don't, and that having such a tool would be helpful for them to benchmark and guide and set improvements over time. So this is sort of an example with open access, but what we're doing is we're actually conducting, again, another Delphi, an iterative survey of institutions' needs and preferences to see what types of transparency metrics we should build into this tool. So one thing that I think would be quite interesting is looking at whether, and we can, but whether it's of interest to integrate into this dashboard something about clinical trial registration and reporting. So do we want to know real time as an institution, you know, what percentage of our trials were registered prospectively, and then subsequently which percentage are reported in the registry. We know that many studies never go on to be reported either as a publication or in the registry. And we want to address that, I think, as a scientific community to limit things like publication bias, as well as selective outcome reporting. And such a tool may help foster that at institutions. So with this funding, we're going to establish this tool, and we're going to develop and evaluate the tool to make sure it works well. And then we're going to look and try to implement it and make it publicly available for other institutions to do the same. Okay, so a bit of a whirlwind tour so far, talking about sort of my academic background, my interest in meta-science and how that developed from some pretty sort of distinct experiences as a trainee. And then I've talked about my sort of role at OHRI and the two hats that I wear, both in terms of consulting and teaching and in terms of research. In terms of looking forward, some things that I have on my mind, I'm very keen to continue to grow my research program. It's a busy month or so in terms of funding. So I'm submitting a grant later this week to SSHRC. I am a social scientist, so I'm hoping I'm desirable to that funder. That's around trustworthy research. I've mentioned I have this TAHAMO renewal going in with my colleague, Dr. Manoj Lalu. That's later in October. There's also an OSU Empower Award that I'm going to submit in November around building an inclusive research environment for patient partners. And I'll speak more to that in a minute. And finally, hopefully before the end of the year, an application to NDRIO, which is a National Data Research Infrastructure Organization. That call has been delayed due to the federal election, but hopefully should come out soon. So just to say that, there is funding in this space. I appreciate not everyone is in the meta-science space, so maybe wondering about that. So I wanted to highlight some of the opportunities that I'm moving forward with. Okay, so in terms of ending off today, I've had the opportunity over the last month or so to meet with many of you at the institution. And indeed, over the past 5 years consulting at the institution, I've met with a number of scientists, talking to them about sort of best practices pertaining to publishing and trying to provide advice and support. But I am interested in sort of embedding my research program at the Heart Institute and doing more in that respect. And I wanted to quite directly address sort of what is the pull to the Heart Institution, because I think several of you raised this in our interviews. So there's a few things that I think would make the Heart Institute an interesting place to continue conducting journalology research. The first is that it provides a manageable sized test bed to do some of the implementation research that I'm interested in. So I think there's the potential to show real leadership for institutions right now as early adopters of reporting and transparency best practices. So these are my research interests, these are my outreach interests. And I think that, for example, something like data management, it's not done well. It's not done well at the Heart Institute. It's not done well at most institutes. So it's not that the Heart Institute is doing relatively worse or better than anyone, I suspect, but now is the time with these mandates coming in. Now is the time for an institution to stand up and say, I would like to be an early adopter. We're going to acknowledge sort of where we stand with data management and make a roadmap of how we're going to improve and document that implementation. I think that would be of great interest to the research community. All institutions face an implementation challenge around something like data management. And the people that do it first, I think, can raise the profile around leadership and the profile of the institution by doing so. And I guess I'm interested in working with senior management, but via a grassroots approach, taking into account scientist perspectives to identify what best practices related to reporting and transparency might be aligning with strategic goals. And we could set about doing an implementation project, kind of analogous to some of the work that we're doing at the Neuro. And just to highlight, no cardiac institution has shown leadership around research reporting or transparency. So again, I think there's this potential of embedding this type of research at the institution to really show leadership. I've mentioned sort of interests around data management. So I wanted to also directly speak for a moment about CardioCore. So most of you, I'm sure, are familiar with CardioCore. I understand it's been an initiative that's taken place over several years now. But for those who are not, it's this vision for a cross-cutting cardiac data repository. And I think it's great. I think it's super innovative. I think as a member of society, when the average member of the public thinks about health research and health data, I think they suspect this is just the norm, and that's just what always happens, that data is used in a way that is sort of disseminated across different institutions and layers of management for others to sort of use their health data to find discoveries and cures and things like this. So I think that it makes sense. I think that's what the patient population would want as well. There's evidence for that too. I think in terms of my interest in data management, I do think I have expertise in this space that could help with CardioCore. I'm going to be really interested in doing so. So I think providing strategic support for data handling best practices is something I'm keen on. And with respect to CardioCore, like any sort of implementation project, there's this sort of sense like it's not true that if you build it, they will come. So, you can create an amazing data repository that people do not use. There's tons of precedents for tools being developed and not used by the community. And part of the reason for that is this lack of user-centered design approach. The tool may not meet their needs. And while it's not true that if you build it, they will come, I think it is true, garbage in, garbage out, that expression. So that I'm saying to basically reflect the point that if you don't have stakeholder engagement as you develop this tool, you could run into a situation, for instance, where clinicians are all putting their data into they're putting their information into the repository in a way that's non-standardized. And then the information that researchers get out is therefore, not in a usable form. So, I think this initiative is great. I think it should be documented, it should be talked about, and it should be something that is positioned as something of leadership at the institution, both nationally and internationally. Before ending off, I wanted to talk about a few other sort of value adds and things about the institution that I think would be great. So, in meeting with several of you, I've learned a lot about the precision medicine program and specifically the Women's Heart Health Initiative. And I just wanted to highlight, as a social psychologist, I do have survey design and methodology expertise. And I think that's something that may lend itself to a number of different areas of the precision medicine strategic goals. In terms of an example, I have a new collaboration with the heart failure unit to support survey development around patient versus clinician priorities for research outcomes. And that's something I'm really interested in. And, I can provide the method support, but I'm really interested in patient engagement and patient partnership more broadly. And I think there's a lot of parallels and interactions between those interests and some of the motivations of the Women's Heart Health Unit, for instance. On that respect, I wanted to just talk for a minute about expanding patient partnerships. So I've been, conducting patient partnership for several years since joining the OHRI. But I'm interested more in doing meta research about patient partnership as well. And I've done a little bit, but I think that some of my experience creating and evaluating training materials could lend itself to this. So I'd like to create training for researchers and patients. And I'd also like to develop standard processes to establish things like patient relevant outcomes and through consensus processes. I think from my perspective, the impetus for patient partnership is very clear. We want to have the patient voice and patient perspective, especially in clinical research, coming through. But I would also say that I have the general sense that most patient partnership that's currently being implemented is often done so very tokenistically. And it's not necessarily because researchers intend for it to be tokenistic, but they're not necessarily aware of what to do. They've been told by CHR, you need a patient partner, so they get one. But the sort of interaction and the dyad of how that works isn't really clear, I think, for a lot of us. So I think I'd be really interested in studying that and finding out ways to determine, when patient partnership makes sense and how to implement it effectively. And I think these goals, in terms of expanding the work that I've done around patient partnership and looking at patient partnership in a sort of meta-science perspective, align with some of the strategic goals around incorporating patient perspectives into the new learning health system, as well as the overall growth of the precision medicine system. Okay, so finally, in terms of things that are interesting about the Heart Institute, I just wanted to also stress that one, I guess, of the great benefits of consulting and working with different organizations is you get a sense of different organization cultures and what is possible. And one thing that is very clear to me from the 5 years engaging at the Heart Institute is that there's a really excellent trainee culture at the institution. There's a very active program. I think Research Services has done a really great job in helping to facilitate that in collaboration with the sort of graduate committee they work with. And, you know, as someone sort of relatively early in their career, still looking to grow their research program and grow their research team, that's something that I find very exciting. You know, these are some examples of some of the students currently working with us or that have recently worked with us. And by us, I refer to David Moore. So, you know, David and I have had the chance to supervise a couple medical students. For instance, this past summer, a undergraduate student funded through a Canadian Standards Association. And we currently have a co-op focusing on data management and knowledge synthesis through the University of Ottawa. So it's exciting for me. You know, I've told you about sort of my path to meta science. Very few people, very few clinicians have training in meta science. So the fact that you could contribute to training the next generation is something I'm excited about, especially if they could be embedded into a broader culture of training. Okay, so that's it for me today. So I've told you a little bit about myself, my research program, my work at OHRI, and some of the pulls to embedding that work at the Heart Institute. Just in summary, before I'm happy to take any questions and discussion, you know, I think meta science helps to ensure research practices and research culture are producing science in a way that maximizes value and reduces waste. So if we don't have meta science, we don't know if we're doing a good job or a bad job. We don't know if the system needs an intervention or not. So I think it's really important to maintain meta science for that reason. Improving reporting quality and transparency of research, I think has a real potential to make research more usable and trustworthy. And that should be a key goal of any research institution or researcher. And just to highlight again that science policies are changing very rapidly to foster transparency, you know, as a research system, but also as a society more broadly. The idea of transparency and openness is really at the fore. And I think, you know, I do and can lead a program that increases the profile of the institution as an early adopter for others to learn from in this space. So with that, I'll stop there and just thank you all for your time. And I see there are some questions in the chat. I don't know if someone facilitates these.
Yeah, I'll do that. Yeah, so thank you so much, Kelly. I think this is really timely and also very exciting. You know, so I think while researchers are kind of busy doing research, never actually get a chance to kind of step out of the box to see the big picture. And at the same time, there are so many environmental changes, right? You know, in terms of upcoming policy and, you know, data management is one example, but there are so many others. You know, you gave the patient engagement is very, very real, right? You know, people kind of grab a few patients and so here's my due diligence on patient engagement, but not truly engaged in any means. And so, and then the other two aspects I think are very important as well. You know, the Heart Institute always prides itself, you know, in terms of kind of being a leading edge thinker and, you know, we pride in innovation. But at the same time, robust methodology for these type of evaluations is absolutely critical, right? You know, it's not just the kind of, hey, we're doing this, you know, but actually thinking about how to do this properly and to be able to actually set the proper hypothesis and the evaluation tools, you know, is actually critical. And I think that is really brought up by your discussion. And then the other thing, which I think is actually quite interesting as well, and it's I guess the totality of the learning process, you know, not only on the kind of the investigator trainee side, you know, but as an institution, right? You know, how do you actually shift the culture? And that, I think that's something that really, you know, using these kind of opportunities, you know, for us to better define, because that's not clear at all, right? You know, in a medical institution, everything is very messy, and you know, and that's why things are never, you know, done, you know, sort of in a systematic fashion, but quite often done in a kind of ad hoc fashion, and then that's why, you know, things always end up kind of much less than, you know. So this is the thing, you know, if you look at the amount of research that's done, the amount of innovation, you know, that's actually done, it's just amazing. And in fact, you put it all together, you think that cardiovascular disease should be cured, right? But in fact, we are doing, you know, something pretty similar to what we were doing before. So lots of good questions. And so maybe I can start here. Rob Inlands is actually a great presentation. And I think he had a question regarding, you know, the question of open science, you know, or actually open access, you know, in terms of journals. And I know right now, for example, one can publish something for immediate open access, but quite often there's a cost associated with it, right?
Yeah.
Even New England Journal, would like you to pay up if you want your paper to open access. So what are the pros and cons? Is it worth to pay the money? And what's your view on that?
Yeah. So I think when it comes to sort of open access publishing, you have to consider who you're funded by. So sometimes you can consider your preference, but sometimes it's what is the funder's mandate. And for those of us funded by, for instance, the tri-agencies, including CIHR, there's a mandate for open access publishing. With that said, it is limiting in terms of the cost. Sometimes is prohibited. Sometimes people's work isn't funded at all. So having funds to publish is challenging. And I think that in those instances, what I recommend is using the institutional repository. So you can there's different types of open access. So you can publish in a journal, and that's a way to make your work open access. But you can also put your work in the institutional repository, and that makes it open access after 12 months. It's an embargo period. And we know that if you do that, for instance, it leads to more citations. So in that respect, publish where you want, but be compliant and make your work open access so that it adheres to funder mandates, but also, you get the citation advantage and the equity of making your work publicly available. And I think in his question, he asked a little bit about sort of IP and open access. With open access publishing, there's no concerns around IP. So you can publish that's not a concern.
Yeah, and we certainly encourage people, to go open access simply because that's, especially when it's CIHR funded or NIH funded. Yeah. So another question is, thanks so much for a wonderful talk. This is from Marcelo Munoz. And so how important is it for us to adhere to the new DORA, recommendations? Certainly we are exploring that, but it's complicated and it's messy.
For sure. I think the point with DORA is right now it's a statement institutions sign making a commitment to move away from impact factor and number of publications as a way of assessing research or researchers. But I don't know of any institution that sort of made the full transition away from those metrics to something different. And that's something that I think many institutions are considering. And we're coming up with at DORA a database or repository of best practices for others to see sort of what's been done. That includes sharing things like standardized CVs institutions can ask for things like at the time of tenure and promotion. So I would say, it's important to start thinking about it because I think it fosters better research culture. I think, signing DORA does not mean that you've effectively eliminated the impact factor. It means that you're committed to considering other ways of assessing researchers. So it's a dialogue, and that dialogue is going to take years. I don't think we're going to get there anytime soon. So I would encourage the institution to engage in that dialogue. I know, for instance, UHN has signed DORA, and they have a committee, and they're looking at what makes sense for them, looking at the institution's researchers' views and preferences as well. And I think that's the first step is to do that.
Yeah. So another question from Katie Rayner, excellent presentation. And so this is has to do with balancing the tension. On one hand, we want to actually promote transparency and collaboration, but traditionally, researchers want to keep everything secret. Don't really actually want to share anything with anybody. And so in fact, you want to keep the tension, until the day, when the paper is, you got the proofs accepted, the things like that, So how do you manage that, the traditional approach, versus, more transparent and sharing collaboration?
No, I think it's a really great point that she raises. So the one thing that's clear is that there is increasing mandates for various transparency practices, and they're coming around all different sorts of things. So open access, study registration, mandates for data management. What I would suggest is that as a researcher, choose, if you're not doing these things, sort of meeting best practices, choose one, your low-hanging fruit, and start doing that one, right? And trying to implement step by step to become in compliance with some of these mandates that exist. I think a big part of addressing Dr. Rayner's question will come with initiatives like DORA. So, I think researchers may find they're much more happy to say share data or share paper in an earlier format if it means that the institution is supporting them in doing that and valuing that. If institutions just value number of publications, then of course not, because you want to tap your data set completely before it is exhausted. But I think that the discussion of those practices alongside the discussion like Dora is having is really critical.
Yeah, so maybe the last question, this is from Dorothy Curran. And so this is reflecting on her experience, for example, when she's trying to do systematic reviews, that there are so many publications that's such poor quality, right? It really actually is very disappointing for the whole field. And so the question is whether one should actually, in fact, on the institution level, to begin to have more of the quality assessment tools for research, like Strobe or MSTAR or any these type of tools, or what you think are the ways in which we ensure quality publications goes out rather than just poor quality publications appearing.
Yeah, so most of those tools aren't like they're not designed for supporting design. They're designed for supporting reporting. But with that said, I think like they can be helpful. So looking at, for instance, if you're doing an observational study at the front end of research, when you're writing your protocol, looking at whether it would have the information that you eventually need to report at the end phase, I think makes sense. Certainly journals, like academic journals, like I got a paper back today with a revise and resubmit that I'm a co-author on. And the team has been asked to submit the reporting guideline as an appendix. So, journals are creating these mandates. So we have complied to the reporting guideline and we've cited that we've done so, but now they literally want like the page number and line of where everything is adhered to. So I think the mandates are coming from journals, and I think it would be useful for institutions to support their researchers in complying with those for sure.
Yeah, and the New England Journal, just last week said that if you publish in a clinical trial, it has to be done in the context of the epidemiology of the field, and you have to demonstrate the evidence of that, otherwise it won't be accepted. So maybe we'll have one last question, because it's a sort of a timely question, and that is that when you have a publications out, whether it's good quality or poor quality, social media will grab these things and quite often will make whatever out of them, and can distort. Of course, we see so much of the fake news sort of being propagated despite so are there any way to mitigate that, or that's really out of our control?
Yeah, I think it's part of knowledge translation and mobilization activities. I think, if you're engaging, for instance, with your comms office, and you can control the message, for instance, through a press release, right? Journalists are human. They want to take information that's been nicely summarized from the non-technical version, and you can help control that. You can engage with knowledge users and patient organizations, get the message out through them to help support that as well. I think the challenge with sort of fake news and misinformation really aligns with some of the work we've done around predatory journals as well. And I think that, it's a space that's moving very quickly, and I don't think there's any easy answer. I think one major thing that will matter is we're going to need to see more contribution and dialogue directly from researchers and the scientific community to sort of maintain and restore some of that trust.
Yeah. Wow. Okay. This is really a fantastic journey. And so, really covers many of the very fundamental questions, right? In terms of really creating knowledge and how to make sure that knowledge is reliable and the highest quality, but at the same time, has the highest impact. So it's certainly we look forward to working with you, to achieve many of these very important aspiration goals that we all share. And certainly it will be, very important set of, journey steps that we take. So thank you so much for a fantastic presentation, and look forward to, more exciting advances from you. So take good care, everybody.
Thank you so much. And thank you everyone for your time.
Bye-bye.